When I have patients, a pregnant mom coming in, my main focus on that mom is to prepare her as best as possible for the big moment, which is her delivery, right? And how I obtain that is one, again, working on the mind and body. So I try to get an assessment based. I usually take a very in-depth history. And so by that, I'm getting an idea of who my patient is. And so based on their personality, based on their life, their work, treatment is so subjective, right? So once I get that, I assess how their mental state is, if they're doing well mentally, any anxieties or any depressive symptoms. And let's say all that is normal, is then when I go on to assess the body. And then I assess what pains they have, if they're having any problems with their current pregnancy, if they're on any medications. So how does osteopathy help? I'm enabling their flexibility. I'm improving the range of motion of the pelvis, of the hips, of the lower back, and I'm opening up that whole pelvic outlet, which involves from L3 to L5, the sacrum. Then you have your both pelvic bones, you have, so it's like the whole pelvic outlet is going to go through significant stresses and changes in the time for that delivery. All right. So by me with osteopathy is I'm enabling those patients to improve their flexibility, to improve that range of motion, to improve and decrease muscle spasms, and to improve their stamina through breathing exercise. And this is where osteopathy, there isn't only one. I keep talking about mobilization and METs, but osteopathy also deals with visceral osteopathy. And the visceral osteopathy is where we don't touch the muscles, but we are looking at the internal organs, from the stomach to the uterus, to the bladder, to the ovaries, fallopian tubes. And so I have a patient who, I think she's coming in, tomorrow. Yeah, she's been struggling with acid reflux, gastritis. She's gone off the medication. And so this is where tomorrow I'm doing visceral osteopathy on her, purely on her stomach. Again, a very gentle, hands-on, to improve gastric emptying, to open up that stomach, to reduce acid production, to let it move through that peristalsis, those contractions, all by itself. So again, very gentle. Is one session going to be enough? Never. It's an ongoing thing, right? So same applies to prenatal, pregnant moms. I'm calming the baby within, I'm calming the uterus within, I'm opening up the pelvic outlet, and I'm relieving any back pain they may be having, any leg cramps they may be having. And by achieving that pain relief, reducing the muscle spasms, it improves their mental status as well. They go home, they're a lot more calmer, happier, baby's happier. So it's like you treat one, the other also gets better kind of thing.